Hello, my name is Martin Klinke. I'm an orthopedic surgeon specializing in foot and ankle pathologies. So anything below the knee, Achilles tendon, ankle, foot, all these pathologies I'm taking care of as an orthopedic specialist and a trained sports medicine doctor. Well, the main reason why I became an orthopedic surgeon was my interest in the musculoskeletal system. That means bones, tendons, ligaments, joints, and had a special interest in the lower limbs. And because there weren't any people around who would take care of foot and ankle problems, I became a specialist in foot and ankle problems, having wrote my thesis about gait analysis, and therefore I then became a consultant at Guy's and St. Thomas Hospital. Before I had a fellowship in Switzerland and in Stanmore in North London, and now I'm only specializing in foot and ankle pathologies, not only from a surgical point, but also from a very conservative point, as I also have a qualification in sports medicine. Well, I think the main thing is we can help patients properly. The musculoskeletal system involves tendons, ligaments, bones, and all these can heal. There are structures in our body that have less potential to heal. So when we see patients, we certainly can make them better. We can't always make them perfect, but we are able to help them a lot. We can give clear advice, we can find out what the problem is, and we have a huge spectrum of treatment options. And normally patients can get back to their normal level of activity if they're injured, if they have an overuse injury. But we can advise, and therefore I'm very happy to say that patients normally, when they come and see me, we can get them back to the level of activities they want to go to. Fortunately, working in the private sector allows us to spend a lot more time with the patient. Not only do we take the history, but we can talk to the patient. What are their special concerns? Why do they come to see me? What are their expectations? Are they realistic? Do they know what are the options, what treatment options there are? Often patients come, they've been seen elsewhere on the NHS, which doesn't always allow enough time for the patient to discuss the specific problems. So we have to understand what their needs are, what they want to achieve, and we can advise them appropriately. So I work together with various people, with physiotherapists, rheumatologists, radiologists. I work with a podiatrist, and we can normally work together and allow the patient to understand what they need and what needs to be done. So not only do we take the history, we can arrange the investigations and then discuss the results and the treatment options. And that has to be a special treatment option for this particular patient, not just general advice according to an algorithm on the NHS. And therefore, we are able to make patients a lot better and make them happy that they come to see me, and to avoid any long queues, waiting, being delayed, not being able to be seen. We can see the patients and I can take care of their problems.